Welcome to The Explainer. Today, we're diving into the surprisingly complex science behind one of our body's most violent reflexes, vomiting. We're going to break down how it all gets started and, maybe more importantly, how modern medicine has figured out how to stop it. So, let's start with a question I think a lot of us have had. You're on a road trip, feeling absolutely awful, but your friend in the driver's seat is totally fine. Why is that? Well, the answer lies deep inside our brain's control room, and it has nothing to do with having a weak stomach. It's all about how your brain is reading the signals. First up, let's get clear on what vomiting actually is. I know, it's unpleasant, but it's not just a symptom. It is an incredibly powerful and highly coordinated protective mechanism that our bodies evolved to literally save our lives. At its heart, your body kicks this off as a last-ditch defense mechanism. It's this whole coordinated effort run by a part of your brainstem, and it has one single urgent mission: get something harmful out of your system and get it out fast. And it's a very specific two-step process. First, you get what's called retching. That's when your abdominal muscles start contracting, but nothing's actually coming up yet. It's your body's way of building up pressure right before the final step, which is, the expulsion. So what can set this whole alarm off? Well, a whole bunch of things. The most obvious trigger is a toxin from something like food poisoning. But it can also be tripped by the mixed signals your brain gets in a moving car, hormonal changes during pregnancy, or even really intense stress. Okay, so where is the command center for this whole operation? Because if we want to understand how to turn it off, we first have to figure out where the on switch is. So let's take a look inside the brain. The real MVP here is a tiny area called the chemoreceptor trigger zone, or CTZ. You can think of it as our body's own little security checkpoint, and its one and only job is to constantly monitor your blood for anything that shouldn't be there. Now here's what's so fascinating about the CTZ. It's all about location, location, location. It is strategically placed outside of the blood-brain barrier, which is that protective wall that normally keeps stuff in your bloodstream from getting into your brain. And this unique spot allows it to have a front-row seat, constantly sampling your blood for any toxins or drugs. If it detects a threat, it does not hesitate. It immediately sounds the alarm, which then travels to the vomiting center. But what does it mean to sound the alarm? It's not a literal bell, of course. The whole thing comes down to specific chemical messengers that basically run over and flip the nausea switch in your brain. When the CTZ spots a problem, it unleashes a flood of these chemical messengers, or neurotransmitters, and you can think of them as different types of alarm bells. You've got dopamine, serotonin, histamine, and depending on the specific threat, the brain will ring a different bell, sending a powerful "evacuate now" signal to the vomiting center. So this is where modern medicine gets clever. Anti-sickness medications, or anti-emetics, aren't designed to just soothe your stomach. No, they are designed to go right into the brain and intercept these very specific chemical messages. It's like they're cutting the wire on the alarm bell before it even has a chance to ring. And since there are different alarm bells, you obviously need different tools to silence them. This is exactly why a one-size-fits-all pill doesn't work for nausea. Picking the right drug for the right situation is absolutely key. You can see it laid out really nicely here. Different classes of drugs target different signals. Take antihistamines, for example. They are fantastic for motion sickness. Why? Because that feeling is mostly driven by histamine signals coming from your inner ear. So the drug just goes in and blocks those specific signals from ever reaching the brain. Simple as that. To paint an even clearer picture, let's just compare two totally different scenarios. Feeling sick on a boat trip? That's caused by a sensory mismatch in your brain. That is a completely different mechanism than the nausea from chemotherapy, which is triggered by a massive release of serotonin from your gut. Because the causes are so different, the solutions have to be just as different. And you see this in other specific situations too. For example, in cases of severe morning sickness, something called hyperemesis gravidarum, doctors have to be very careful. They often choose drugs like promethazine and metoclopramide because they're known to be both effective and a safer choice for that particular condition. Okay, let's wrap all of this up with the key takeaways. If you remember anything from this explainer, I want it to be these 3 points. Okay, here's the bottom line. First, treating nausea is all about precision. You have to target the specific cause, not just the symptom. Second, the development of drugs that block serotonin, those 5-HT3 antagonists, was a massive game changer, especially for cancer patients. And finally, a quick note on doing the opposite. We just don't use drugs to make people vomit anymore in cases of poisoning. It's now considered way too risky. And that really leaves us with a final thought, doesn't it? We've learned how to silence one of our body's loudest, most violent alarms with incredible precision. And it just makes you wonder, what other internal systems, from pain to anxiety, might we one day be able to control with that same level of understanding?